Equine Piroplasmosis. The host is the horse, whereas the vector is the Babesia canis and the cattle tick. More often, equine piroplasmosis is seen in the acute form characterized by a fever, a loss of appetite, these are healthy horses. Eden. Hey. The horse has a sudden onset of immobility. This is a healthy horse filled with energy. Lastly, the horse will suffer with severe depression. This is a healthy, non-depressed horse. The fever may subside after one day and become intermittent. Other signs include anemia, jaundice, and an enlarged spleen and liver. The protozoan that causes equine piroplasmosis are Babesia cabali and Theileria. To diagnose EP, you need to send blood samples to a lab. The parasite may be detected on microscopic examination of a blood smear, but detection of the parasite is not always possible by this method of testing. The most commonly used tests are serologic tests that detect antibodies to the organism in the blood. As the standard test for screening for equine plasmosis in an outbreak situation, different types of tests are often needed to determine the infection status of a horse. This is a blood smear showing mucoids of Babesia cabali. These are some types of serological tests used to diagnose equine piroplasmosis: CFT, the indirect fluorescent antibody test, and the enzyme-linked immunosorbent assay. In addition, a simple and rapid immunochronographic test for T. equi has also recently been described and might be a very useful test for the mass screening of serum. This is what the serological tests look like. The infected horses were treated experimentally with imidacarbdipropionate, a drug used in dogs and cattle, but previously untried against piroplasmosis in horses. Horses were given 4 injections spaced 3 days apart. This treatment eliminated the disease-causing parasite in all but one of the 25 horses in the first sample group. That horse recovered after a second round of treatment. Who is the host and the vector of EP? The host is the horse, and the vector is the Babesia canis and the cattle tick. What are some of the symptoms in the horse? Fever, loss of appetite, sudden onset of immobility, and severe depression. What 2 ways is EP diagnosed? EP could be diagnosed with a blood smear and a serological test. What is the protozoan that causes EP? Babesia cabelli and Theileria. What treatments should you use to treat EP? Imidacloprid dipropionate. I'm horrible at saying that, by the way.